Good afternoon. Today we are going to talk about hypertension and acupuncture. I am Dr. Dolopo. I've been in practice for the last 24 years. I actually just started my 25th year in practice here at Elements in Harmony Acupuncture and Chinese Herbs. Visit us at elementsinharmonyacupuncture.com. And we have other doctors that work with us here, as well as a neuromuscular sports massage therapist. But I'll talk about that later. Let's talk about this amazing case. This woman is a grandmother, and she's a lovely lady. She's been on blood pressure medications, and they were giving her very limited results with sometimes her blood pressure going up to 210/90. And she didn't want to add even more medication to what she's already taking. She told her doctor, you have to stop giving me more medication and more. We have to treat this in a different way. So I have not put her on herbs at all. It's all acupuncture. And what I want to share here is that I do balanced method acupuncture. I'm a Dr. Tan Gold Level Certified Balanced Method Acupuncturist, as well as a doctor of acupuncture and Chinese medicine. I'm board certified and I'm a licensed acupuncturist, as well as Dr. Shorai Omedi, who's a doctor of acupuncture and oriental medicine, licensed acupuncturist, Dr. Lin, and she's also a doctor of acupuncture and Chinese medicine, licensed acupuncturist, as well as Pam Cower, registered nurse and licensed acupuncturist. I share this because this is how we're able to be open 6 to 7 days a week. I want to share how this particular grandmother has achieved. Today, she told me she came in, she said she's feeling really good, and her blood pressure was 121/80. I just want to make sure I give the correct information. She said she feels like something's really been changing. Nothing has changed with her medications, so she feels like it's all acupuncture. It was actually today, July 18, 2023, 124/80. So I will give you the dates of her treatments. She has not actually been very aggressive with her treatments, so I told her to just be patient. I tell people if you don't come 2 or more times a week so we can see fast results, and if you go once a week, then if you're going once a week, you have to be super patient. So she came in January 9, 2023 for her first visit. January 19, January 26. So in January, she had 3 treatments. Then we have, in February, she had 1 treatment, February 9. And then March 2, in March, she had 1 treatment. She's a retired teacher, so she's, having to be very patient with her results. April 11, April 24, April 27, 3 treatments in April. Then in May, 1, 16, 25, 3 treatments. In June, 1, 25, 12. June 1, 5, 12, and 30. So she had 1, 2, 3, 4 in June. And today, July 18, she had her treatment. So let's see how many treatments she's had. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 16 treatments. Today's actually 15 treatments to get her blood pressure ranging from 160 over, it would go anywhere between, with meditation, 156, blood pressure would range 176/80, 210/90 when she was working with me, and it would do this. And I tell people, and if you watch my accountability and what to do to have great expectations with working with me, the beginning phase for chronic issues is those first 20 treatments. When a person is at a point where their blood pressure is not in the correct range, this is not an easy case. If you're having to take a blood pressure medication every day, that is a situation where it's already a chronic situation. I don't really subscribe to, it's genetic. It's genetic in my family, but I have been receiving acupuncture since I was 20, and I'm 49 now. And there are many people who I've been able to significantly improve, get into range their blood pressure so they can have this dialogue with their doctor about slowly reducing or potentially getting off their blood pressure medication, because sometimes people have side effects and they don't want to deal with those side effects. But if that's the case, then they have to really work closely with their medical doctor, their Western medical doctor, in regards to how to do that safely. You know, when a person's blood pressure is 210/90 and they're on several medications, you can understand why they don't want to add more. You know, I think if you're on 2, 3, I don't know if there's 4, typically I see people on 3 medications for blood pressure, 2 or 3. It's rare that I see someone with just 1. And it just keeps going up and up and up. It doesn't really instill a lot of faith in the patient that another drug is going to help them. So that's where our work comes in. So I tell people, if you go under once a week, just expect very marginal results. If you're going once a week, I want to see 30 to 70% improvement in 2 to 4 months. So, usually people get those first 20 treatments done in the first 2 months because they're more aggressive. For example, like the sperm motility video that I did. I got that sperm motility range from 2-3%. The video says 3 to 6%, but I remember them telling me it was 2%. So let's say 3 to 6%. And in 20 treatments in 2 months, I got the sperm motility from 3 to 6% to 42%. The threshold is 40%, especially for fertility. I had read a study that in Texas, they liked it better. The study recommended 50%. So he gave me 8 more months. So in a total of 10 months, we got it from 6% to 72%. So in the first 2 months, we got it from 3 to 6% to 42% in 20 treatments. And then we did another 8 months, and you can look exactly how many treatments those were. And I got it to 72%, which was far above the threshold of what the fertility specialist wanted. So the same thing with blood pressure or any numbers you give me, whether it's platelets, white blood cell count, red blood cell count, whatever it is, you give me the numbers and I'll give you a plan, and I'm going to tell you this is what you need to do, and this is what I want to see. I did that with the fibroid, getting it from 11.1 centimeters to 8.8 centimeters. You can watch that video. And that was in 14 treatments in 2 months. I like to see lab tests in 3 to 6 months, but sometimes people kind of push it a little sooner. In this case, she started January. It is now January 21. It is now July 23. So January, February, March, April, May, June, July. So 6 months, we got from ranging between 160 to 210. With meditation, it was 158. And today, she said it was 124 over 80. Now, that doesn't mean that her doctor is going to give, the okay to lower the blood pressure. And she may or may not, but she's feeling better. Now, she and her doctor will make that decision regarding if the side effects are bad enough. My job is to lower the medication. I don't care what you do to lower the blood pressure. I don't care what you do with the blood. That ethically and legally, that has nothing to do with me. But if a person comes here and they say, hey, help me, my blood pressure is 170, 180, 190, 200, 210, and I'm on all these meds and I can't, I feel badly, I don't feel comfortable. Well, then that's where I come in. So, something to consider. 124 over 80. She hasn't changed the meds. We'll see what she can keep doing. She's a grandmother. Another person who came in yesterday, also a woman who's an elderly woman, and she's very happy. Her blood pressure is significantly lower than it had been months ago, and her doctor doesn't want to lower the blood pressure medication. This woman likes to be natural, so she'll give it a few more months, but if she starts feeling too weak from the elevated blood pressure dosage, she's probably going to talk to her doctor about lowering it, because she just wants to be I think she's on a low dosage already. Actually, she's on a low dosage. She wants to get off it. That's what it is. So, you know, I'll leave that conversation between her or her doctor. She's already on the low blood pressure medication, but even with the blood pressure medication, this second patient, it wasn't giving her the results that she wanted. I had been working on her blood pressure. She told me yesterday she's seeing great results. She will have that conversation maybe in another 1 to 4 months with her doctor about, look, I've been doing acupuncture. This is the range of my blood pressure. Can we lower it even more? But I think she's at the lowest dosage, so we'll see, you know, what she ends up doing. If you want to lower your blood pressure, and if you want to stay on your medication, and that's comfortable for your doctor and you, so be it. If it's a conversation you want to have with your doctor about eventually lowering your blood pressure, or maybe you're on a lot of medications and that's one medication that you'd like to get off, that's the conversation you have with your doctor. But I will give you a plan on how to do that with acupuncture. All right, Elements in Harmony, Acupuncture.com. Dr. Shore Omedi, Dr. Hope Lynn, Pam Cower, all these powerful ladies are here with me. We are typically available 6 to 7 days a week. We have an amazing neuromuscular sports massage therapist. She's been in practice for over 20 years. Nicole Davidson is amazing. Text 619-341-4341. Give me your full name, email address, and I'll share with you her rates and the length of time to be here. If you want, you know, a 60 or 90 minute, depending on what style massage you want. Elements in Harmony, Acupuncture.com. We're here to serve you. Thank you for watching. Take care.